Member for Kelowna Mission.
Thank you so much, Honourable Speaker. It's time. It's time for this Premier and this Minister to admit that we are in a healthcare crisis. Thank goodness for our healthcare workers, and thank goodness that they actually admit the crisis and are here, they're speaking out. Dr. Jeffrey Epler is an emergency physician at Kelowna General Hospital. Yesterday, he spoke about the hospital overflowing with more patients than they even had in available stretchers, and with people suffering because they're in hallways and alcoves. He says, and I quote, "I've never seen morale lower than it is now, and I've never seen such turnover," end quote. Why on earth is the Premier spending $1 billion on a vanity museum project when our healthcare system is falling apart?
Minister of Health.
Thank you very much, Honourable Chair. And as the member knows, the healthcare system and the extraordinary healthcare workers around British Columbia have responded, I think, in a remarkable way to 2 public health emergencies and all the challenges facing healthcare. And they have, I think, on behalf of people in BC, achieved an enormous amount. That's in Kelowna, where diagnostic care has been expanded for all people and for cancer patients, where we've reduced wait times in a pandemic for surgeries, where we've gone from 8th place to 1st place in orthopedic surgeries, where we've increased access to diagnostic care in every health authority, most importantly in interior health. Right now, of course, the healthcare system continues to face some fundamental challenges, one of which is that there are, right now, because of COVID-19, more people off sick, dramatically more people off sick than there was in 2021, in 2020, and of course before the pandemic in 2019, which leads to challenges every single day. Last week there was between 15 and 16,000 people who missed at least one day. And I think it is remarkable that in that week, a week where healthcare workers face such incredible challenges, that they delivered such a very high level of service. I hear and speak to healthcare workers every single day. It's why we've added 32,000 healthcare workers in the last 2 years, and why we're going to continue to add resources to support our healthcare workers who've done a remarkable job in difficult times.
Kelowna Mission Supplemental.
Thank you so much, Honourable Speaker. And I laud, I sing the praises of every single healthcare worker in this province. They have done extraordinary things, and now they are speaking out because they are tired, and they are giving us the warning signs and sounding the alarm bell that our healthcare system is failing. Dr. Epler said yesterday that he is angry about what he called the government's false narrative and the untruth being spread. And he says, and I quote, "I don't know a single practicing emergency physician that really feels that UPCCs are the solution. To present it as a solution to our healthcare ills is simplistic and actually dishonest on the part of the government," end quote. So only in NDP land is everything okay with our healthcare system. Why is the Premier doubling down on a $1 billion vanity museum project at a time when our healthcare system is in crisis?
Minister of Health.
Honourable Speaker, members of the House will know this because they may be more familiar with this period than I am. From 2003 to 2017, the number of people without a family practice doctor in BC doubled in that period. That a promise was made in 2010 to provide everybody with a family practice doctor, as it turns out, by the Leader of the Opposition when he was Minister of Health. That plan was abandoned in 3 years. We are taking significant action to support primary care across BC, and the core of that action in Kelowna are primary care networks, which were developed in concert with divisions of family practice, in other words, with family physicians. 52 full-time staff, Honourable Speaker. The member refers to UPCCs. Well, Honourable Speaker, we've gone through a period in the pandemic where the majority of visits to family physicians were in person to a period where the vast majority were virtual. UPCCs in that period played a fundamental role and an important role in assisting people. 1.3 million visits. And at the Kelowna UPCC, that number was 85,000 visits up to March the 3rd. At the Kelowna UPCC, which has 25 positions and 25 positions filled, people have come to the UPCC to provide support. But it is only part of the primary care network solution and only part of the response to the challenges facing acute care. And that's why in every area of healthcare, we've added resources and staff in this dramatic period of pandemic. 32,000 additional staff in long-term care, support for diagnostic care, support in acute care, and support in primary care. And we need to continue to do more to support, in particular, our family physicians in providing service in the community.